Tracy.
Hi, I'm Tracy Doyle from GE Healthcare IT, and I'm joined today by Harel Kodesh, our Chief Technology Officer from GE Digital.
Thanks, Tracy. Good morning.
Good morning.
Or you say good
right,
afternoon.
depending on what time zone we're
exactly.
in. So, Harel, we're here at HIMSS, which is the largest health information trade show. What's the opportunity for healthcare in the digital space? What are we looking at?
I mean, what you see here is pretty amazing. I mean, it's first the opportunities that not only come from GE, but from all the ISVs that want to work with us. But when you start looking at information, it's clearly moving away from textual information, health record, static health record, to analysis, big data analytics, and really machine learning, in which you can see basically a heart pumping, and you can analyze the flow, you can analyze any issues with the flow, and you look at it, it's real promise, way beyond textual information. It's not that text is not going to be important, but you see so many dimensions coming together that it's pretty amazing.
Right, and I understand it's all about the insights that we gain from that data as well.
Absolutely. So it looks like a clinician can get much more insight and can really get help from the machines and see things that otherwise it's going to be impossible for him to see. I just looked at some of the applications that folks showed us. You see, you can analyze the flow. There's no way that a clinician can analyze the flow without, doing a open heart surgery. At the same time, this information is available right now with a little bit of machine processing. So
right.
Very exciting.
We're on the cusp of an exciting new era here.
Yeah.
So you mentioned the ISVs, independent software vendors, and we're announcing several of those joining the GE Health Cloud today. What's the role of an ISV? Where do you see that audience going?
So if you think about that, if you take a look, for instance, at Apple App Store, Apple itself, is building about 6 applications out of the 12,000 that they have in Apple Store. But what they do is they give people the platform and the ability to both develop, deploy, and monetize their applications, and we're going to play the same role. So the idea of the health cloud that is based on Predix is really be the platform for innovation and development, and then it should be also effectively the application store for very complex type of applications that are going to help clinicians and patients.
Excellent. So it's a whole ecosystem.
Absolutely.
Right, absolutely.
Yeah.
So one other follow-up to that, you mentioned Predix, and that's our platform, and I know you're the lead on that. Could you tell us a little bit about the progress being made there and what's next for Predix?
Yeah, so, we spent most of 2015 building the foundation, and, like in every construction site, you see foundation. You may get excited about it if you're a civil engineer, but actually it tells a very little part of the story. What you're going to see in 2016 is us getting into the real, core of the business, which is building the infrastructure for machine learning, ability of ISVs and GE to build applications that take advantage of both supervised and unsupervised machine learning, and really push the envelope on the processing of the data that goes beyond everything we've seen to date. I mean, if you look at most of the players here, no disrespect to them, but a lot of them are still in the business of presenting information that is fairly obvious to you and I or anybody that is looking at a piece of paper. What we're going to go is way beyond that, into taking the data, and pretty much the same way we do in industrial ecosystem, actually looking at data coming from patients, looking at various tests and blood records and protein records, and try to build something that actually is not going to be obvious at all. So this is really going to be the leap, in my opinion, in healthcare and medicine in general.
And I had the opportunity the other night to meet a few of the people who are developing analytics on the Predix platform. And they were talking about the digital thread that runs throughout and how Predix enables development all across GE. What's the value of that?
So for most of GE, the digital thread, if you think about it, is really the ability to trace a machine effectively from cradle to grave, right? You see how it is manufactured, you see how it goes through the engineering, development, procurement, and then operation, and there's a lot of information in the process that you can learn from in order to optimize the operation. When you think about healthcare, it's slightly different, because we're talking about workflows, right? So as the first time patients knock on a clinician's door with something that he or she doesn't know what it's all about, until they get the diagnostic and the treatment. They can go through multiple experts, multiple clinicians, but it's actually the same person. So it's important to trace and carry all the data that they accumulate, from one place to another, and let each one of the phases in the loop take advantage of the information that was aggregated to date. So if you think about the digital thread in healthcare concept, it's actually getting closer and closer to what we have in terms of individual medicine. So we're very excited about that. This is going to push the envelope on everything else around here.
That's huge. That's the latest on personalized medicine and the whole initiative
Absolutely.
around that from the government.
Yeah.
So last question, scale of 1 to 10, where's the healthcare industry in terms of really capturing the opportunity in digitization?
Well, I think, there's, in my opinion, it's about 7. So in terms of the technology, it started to come together. I mean, not only us, but competitors, in the business like IBM and others are starting to realize that actually the beauty of everything we do here is the ability to generate a lot of data. If you think about, sensors of machines, it's great that they generate data 24/7, but you think about the amount of information in a single MRI image, it's orders of magnitude more. At the same time, regulation and silos between consumer type of medicine, getting a non-FDA device, combining with an FDA regulated device, and getting the clinician the information that he or she needs, irrespective of where it came from, still has, a bunch of hurdles, legal hurdles, regulatory hurdles, so, which is something that you have much less of in other businesses. So all in all, it's huge promise, and confident that at the end of the day, if we have the answers, the regulators will accept that. And so that's going to be very exciting.
Right, and I think the industry and the patient will demand that.
Absolutely.
So, right. Well, thank you, Harel.
Well, thank you very much, Tracy.
Thanks for joining us.
Thank you.
Okay.